everyone. Thank you so much for being here with us today. My name is Emily Ramshaw. I'm the co-founder and CEO of the 19th, a national nonprofit newsroom where issues of maternal health and caregiving are really central to what we cover. I'm also a mama, and I am thrilled to be here today with this extraordinary group of women who are really working to change the game in this space. And I'm going to tell you a little bit more about their backgrounds before we dive into this conversation. So I'm going to start to my immediate right. Illinois Congresswoman Lauren Underwood is the first woman, first person of color, and first millennial to represent her community in Congress. She is also the youngest Black woman to serve in the U.S. House. Congresswoman Underwood co-founded and co-chairs the Black Maternal Health Caucus, which elevates the Black maternal health crisis in Congress and advances policy solutions to improve maternal health outcomes and end disparities. Latona Giwa is a birth doula, nurse, lactation consultant, and birth justice advocate. She's the co-founder of the Birthmark Doula Collective, which is Louisiana's largest birth worker organization, and she's the co-founder of the New Orleans Breastfeeding Center, Louisiana's first freestanding breastfeeding clinic. Some of her recent collaborative projects include a statewide network of lactation support circles for families of color and a community-led queer pregnancy and parenting project. And of course, Christy Turlington Burns, the internationally acclaimed model turned founder and president of Every Mother Counts, an organization that has invested more than $25 million in programs globally focused on making pregnancy and childbirth safe for every mother everywhere. She's also the director and producer of the documentary film No Woman, No Cry, about the challenges women face throughout pregnancy and childbirth worldwide. So thanks again to this incredible. So, Representative Underwood, we're going to start with you. We just saw the powerful trailer for Every Mother Counts' new film, which is Giving Birth in America, Arkansas. And the main message is that the state of maternal health in the United States is honestly deplorable. Can you help sort of set the stage for us? Give us a little bit of context about the maternal health crisis in the United States and sort of where we stand compared to other countries?
So the United States leads the industrialized world in maternal deaths. For every death we have in this country, we have 70 near misses. So we have a combined maternal mortality and severe morbidity crisis. But within the deaths, we're seeing disparities in who is dying. So Black moms are 3 to 4 times more likely to die of pregnancy-related complications than their white counterparts. Native moms are 2 times more likely to die. And then we see regional disparities for AAPI people, Hispanic moms, and then we all, I think, are very familiar with some of the rural health disparities in this country. And so as a result, the state of maternal health in the United States is very poor, but 80% of the deaths are preventable, 80%. And so in 2023, by and large, we're effectively making a choice to allow our moms to die. And what we're saying with the Black Maternal Health Caucus is no more.
Amazing, thank you. Latona, we've just heard about the dire state of maternal health in the United States. You're the co-founder, as we said, of the Birthmark Doula Collective based in New Orleans. You work in the community, on the ground, with mothers, with birthing people, with families. What are you seeing on the ground, and what healthcare gaps are you seeing in communities?
Absolutely. So what I'm seeing with the birth workers in my community and with the families that we serve is that Black and brown families are bearing the brunt of a dysfunctional maternal health care system. So we often find ourselves in this binary of care where we're either getting overly aggressive, overly medicalized care, or we're being neglected and dismissed, asking for help and not receiving it. So many times when a Black woman has died in labor or the postpartum period, she asked for help multiple times, right? And that's where doulas and community health workers come in, is because we are with families in community, in their homes, going with them to appointments and to the hospital. But the reality also is that birth workers are now bearing this huge burden. We are in the Gulf South, we're in Texas, one of the most dangerous places to be pregnant in the country. And without safe access to abortion care, that means that birth workers are taking on more and more work, sicker and sicker mothers, and we're not getting more support.
And what are the kinds of support that you all need?
We need money.
I set her up for that.
Thank you. We absolutely need funding. We need the advocacy and policy support from the top to make our work feasible. We need reimbursement from insurance companies that is fair and equitable and doesn't put birth workers in poverty, but to actually have sustainable jobs.
Thank you. And Christy, obviously you founded Every Mother Counts in response to your personal experience and to the broader mental health crisis facing this nation. Can you start by speaking briefly just about your own personal experience and what led you to start EMC?
Yes. So yes, I became a mother in 2003, and after a very normal, healthy pregnancy under the care of a midwife, I experienced a postpartum hemorrhage. And postpartum hemorrhage is the leading cause of death worldwide for mothers. And that experience and the sort of realization that without having access to the care that I had on that day, and that being the difference, was what made me want to do more in this space. And Every Mother Counts took a little while to figure out like what would it be and why, what could we do, what would be the value add. And I would say most importantly, it's been about elevating this, this topic and being able to support organizations like Birthmark doulas and so many other incredible community-led organizations across this country who are filling those gaps. And it's fortunately and unfortunately because they shouldn't have to, and yet I'm so grateful that they do, but we really need to do so much more.
And how have you found your responsibility or your mission in this space to change over the last decade?
Well, I'd say that the conversation is at least a conversation. When we started Every Mother Counts in 2010, we weren't talking about maternal health. Not anywhere, not here, not internationally, or we were just starting to internationally. And so that's been a huge, huge, I would say, change. But today, a mother is more likely to die from a pregnancy or childbirth-related complication than her mother was a generation ago.
Wild.
And so we're going the opposite direction. We were talking about this earlier, like, to fall further behind, we're currently ranked 62nd, according to the WHO. I mean, that's embarrassing, it's unacceptable, and we have to commit ourselves to making it stop.
And how do you think we got to this point? How are the numbers going in reverse?
I mean, I think in part, the attention to the numbers has been, you know, we have a lot more to do in terms of understanding what that data is. I mean, a lot of the work early on as an advocacy organization was just trying to really advocate for consistent reporting, right? Like what were we collecting at each state? Because each state was counting maternal death differently. So having at least a consistent, standardized approach to the way that we're looking at this issue, but that's kind of what's brought to the attention that half of our maternal deaths are happening postpartum. We didn't know that before. So, I mean, the awareness is really important and at the beginning of being able to know, like, what do we then do? And I would say that's where Representative Underwood's leadership and really, like, just incredible work and leadership really has helped us keep this conversation going, but then link it to those really important policy conversations and bills that are gonna actually change the way that we treat mothers, the way that we invite them into the system, and how we care for them.
Well, we've talked a little bit about the problems. I do want to start to break down the solutions. Representative Underwood, obviously you've been a champion for maternal health and birth equity throughout your time in Congress. How do we focus on sort of policy and legislative changes that really eat away at this problem? Like, what are the specific solutions you all are proposing?
So what we have done is we have looked to the evidence. There is a wide, deep range of biomedical evidence that tells us exactly how to prevent maternal death in this country and how to save moms' lives. We have taken that data and we've turned it into legislation. I wrote a bill, it's called the Black Maternal Health Momnibus Act, which is a comprehensive set of legislation, 12 bills in one, to address every clinical and non-clinical driver of maternal death in this country. So we are growing and diversifying what we call the perinatal workforce. More OBs, more midwives, more nurse midwives, more lactation consultants, more doulas, and we need them to be diverse, and we need them to be available in every community in this country, which we do not have right now in the United States of America. That's part of the Momnibus. We have provisions to address what we call social determinants of health: housing, nutrition, transportation, environmental conditions, which we know are leading to maternal deaths in this country. And then, obviously, we know that there are some, opportunities. There's a thriving tech sector, but it's not equitably available to all moms in this country to make sure that that's happening, right? We're trying to solve these problems. And in some, we know how much it costs. $3 billion to pass the Momnibus and the mandatory postpartum Medicaid expansion, year-long Medicaid coverage in every state, and we end this crisis. Is $3 billion a lot? Yes. But what we do in the Congress is we spend a lot of money on things that are not proven. We spend a lot of money on things that we hope maybe one day, someday could perhaps work. This is something that we know will save lives, and we are asking our colleagues to do this work and make this investment.
First of all, excellent name of the legislation. Way to go with the acronym.
Thank you.
Talk a little bit about where it stands in Congress. Yes. Obviously, the House is incredibly divided. Do you have bipartisan support? Is there a movement afoot really to push this through?
Okay, so we first introduced the Momnibus in March of 2020, like a week before the pandemic, right? So COVID changed everything. And to your question earlier, what has influenced the death rates? The pandemic has made things worse. So we have to be very clear-eyed about that. In 2021, in November 2021, President Biden signed into law the Protecting Moms Who Served Act, which is our bill to help veteran moms. And so that's being implemented within our VA health system because, again, within the VA, we're seeing these disparities, a single-payer health system where everybody is getting this coverage and moms are still dying, right? Preventable deaths. 80% of the rest of the Momnibus was included in a piece of legislation called Build Back Better, which passed the House, did not pass the Senate. We came very close at the end of last year of getting it included in the federal funding package in December, but we didn't get across the finish line because of, we didn't get across the finish line. And so what we are trying to do right now is we have to reintroduce the legislation. It's a new year, new Congress. We are working to get bipartisan support and some Republican champions. So if y'all have some ideas, let us know. And once we get that signed into law, which we are trying to do this year, we are already working on Momnibus 2, which is our follow-up legislation with all of the things related to maternal health, repro health that have been under-resourced or under-invested in, under-researched, but aren't leading to maternal death. Fibroids, endometriosis, polycystic ovarian syndrome. There's all these issues related to miscarriage and stillbirth, right? And so we need to tackle that as well. So we're already thinking ahead, but we are very committed to getting the Momnibus signed into law.
Thank you. Latona, I'd like to ask you why community-led responses to the maternal health crisis in the U.S. are so critical. I mean, obviously we know that so many people are sort of on the ground trying to do this work. People in communities generally relate better to people who they already know when their community is on the ground. Can you sort of share an example of community leadership that has effectively led to change in this particular arena?
Yeah, absolutely. And I just wanted to say that the New Orleans Momnibus is an initiative that I'm really proud to be a part of and is an example of bringing the community level and the legislative level together to make real change. But it's so important for community-based organizations to be at the table because we are at families' kitchen tables. We're sitting there with the pregnant person and their mom or their grandpa or whoever is supporting them, and we're seeing the reality of their lives. And then we are bridging that with the higher level changes that need to happen. Organizations like mine, doula collectives all around the country that often are Black or brown or indigenous based have been waiting for changes to happen at the policy and legislative and insurance reimbursement level that moves very slowly. But in the meantime, we have been acting. And so we have figured out how to use sliding scale funding models that take money from folks who can afford it to be able to provide services to those who cannot. We are accountable to our communities. We use mutual aid models. So, for example, after Hurricane Ida and Katrina, and we know that the connection between environmental issues and reproductive justice is so important to talk about. But after Hurricane Ida, Black, pregnant, and postpartum people were just left out to dry with their babies, no access to formula, no access to obstetric care, right? And organizations like mine did mutual aid, just getting cash into the hands of Black parents who know what they need and just need support doing it, right? So we're acting on a faster scale and a more direct scale in our communities than wonderful people like Representative Underwood can, right? And we need action on all of those levels.
And just to be clear, you currently can't get any federal reimbursement or any kind of reimbursement for providing doula care, for providing lactation consulting, any of those things?
In general, doula care is not reimbursed by insurances in the United States. There are particular states that are piloting Medicaid reimbursement. We are very a part of those conversations. We're doing pilots with some Medicaid payers right now. We do collect insurance for things like lactation support. So it's a varied model, but that creates dysfunction and inequity, right? When everybody can do something different, it means that people who are already marginalized are going to be further marginalized. And again, Black birth workers do not need poverty wages. We do not want to end up with the same terrible birth outcomes that we're trying to prevent in our clients, right? We need sustainable wages and sustainable reimbursement rates.
Thank you. Christy, can you speak to what you see as the critical role of storytelling in sort of, changing the national dialogue around maternal health? I still think so many people don't understand how dire the straits are in this country. And how have you and EMC thought about the responsibility of sort of narrative shift in this space?
Yeah, I think that filmmaking and storytelling is really the way that gets to people's hearts. This is an issue that is so human and that all of us are connected to once we make that connection. So for us, it's been the part of the organization from day one, from No Woman, No Cry. But I would say the idea is more than that, right? It's the storytelling to sort of elevate and bring the statistics to life, but it's also being able to elevate the models of care, the individuals in the communities that are making the difference.
Grantees doing the work.
Yes, yeah. Exactly. And that relationship, which is so important. We advocate for the relationship and the trust that's established and built at the community level more than anything. So the films help to demonstrate that. And then when we can really align with policymakers, because the stories also help to inform them. There are a lot of things that come across the desks of any one of our representatives, right? And it's very hard to sort of stand apart from the stack, probably, I assume. Yeah. But when you have a story and when it becomes so clear and so simple that the evidence is there, the solutions are known, all we have to do is come together and take action. And so I feel like the storytelling is really the entry point, but really it's a very comprehensive kind of way that we're trying to approach this issue and make it feel more tangible for all of us.
And can you add one thing on that? There's a lot of people who would like to assign blame. She didn't go to the right provider. She didn't get her prenatal care. They did something wrong, and as a result, mom died. But we know in this country, right, the things, at least for Black moms, that might be protective for other populations, income, education status, insurance status, getting prenatal care, whatever, don't protect against the death. So it's telling the stories that help remove this idea of assigning blame and helping people to understand that we are trying to address a systemic problem that is killing people in this country. And I have found storytelling, at least on Capitol Hill, to be the singular most effective way to get folks on board.
Those films need to be all over Congress. Can you speak specifically to one particular example of a story that you all were able to tell that moved the needle?
Yeah, well, actually, Louisiana, we did a Giving Birth in America, Louisiana, back in 2017. And through the sort of research that we did on the ground before we went down there, we were able to kind of ignite some interest. And the former Secretary of Health was Dr. Rebecca Gee, and she then was inspired to create the first maternal mortality summit in New Orleans the following year. So it then brought lots of stakeholders together to be able to continue the conversation and sort of focus on solutions. So that's just one example, but I feel like depending on who you have in the room, and when I've been at South by Southwest before, having a panel and a conversation and a film really allows more stakeholders to come to the table, like everyday citizens, moms, dads, birthing people, and also physicians, providers, doulas, community-based people. Like, it's this mix that I think is so essential in moving this conversation forward and actually reaching the place that we're all trying to get to. And so yeah.
Amazing, thank you. Representative Underwood, I want to talk for a moment about the sort of current political landscape, and it's a particularly tumultuous time for maternal health, but it's also a pretty rocky time in politics in this country. Obviously Republicans took control of the House in the midterms. Within that context, what do you think this means for efforts to advance maternal mortality? How are you working to sort of build alliances? I mean, in theory, in a time when many Republicans have been pushing for restrictions on abortion, banning abortion in many states, in theory, there should be more resources then going toward people who are delivering babies?
Well, in a post-ops world, we know that there are some Republicans who recognize the reality that we face, which is we are going to have to be even more serious about offering solutions, affirmative solutions that help save moms' lives, given that in many of these same states that are advancing abortion bans, they have at just a baseline level of much, much, much higher risk of maternal mortality and severe morbidity. And so we invite those folks on the other side of the aisle to join our caucus. The caucus is bipartisan. Okay, let me just start there. The Black Maternal Health Caucus has always been bipartisan, and the Republican members come to the caucus with deeply personal reasons for why they care, right? So they share our commitment. There are bills within the Momnibus that are bipartisan. Some are only bipartisan in the Senate, some are only bipartisan in the House. Like, we welcome people to support this work for whatever reason. But I think the key is they need to share our commitment to taking action. And what we are seeing is that in this environment where many states are taking action to restrict access to health care, period. At the federal level, we need to take action to expand access to health care and make sure that it's not punitive, make sure that we're breaking down barriers for providers to be able to practice to the top of their licensure, and make sure that we are doing so in an affirming way that the funding, that people can count on the funding, community groups can count on the funding because they've been leading on this effort for so long.
How many Republicans do you have in your caucus?
Well, it's a new Congress, so people have to re-sign up. So what I would invite people to do is, and I'm assuming you all know this, right? We had an election in November. In January, you remember when it took several days for the Congress, 15 votes, right? So we're really just getting started with everything now. If you would reach out to your member of Congress, unless you're a DC resident, you have 1 representative and 2 senators. That's 3 people to be in touch with and ask them to join us at the Black Maternal Health Caucus. And from there, we then work with each member and member's office to make sure that they understand the work that we're doing and the way that they can support these initiatives to fund existing programs through appropriations or to co-sponsor the legislation as we move forward.
And how do you see any of these conversations playing out in the 2024 elections? Obviously, reproductive health is in the minds of a lot of people. How does this fit into that conversation, the abortion conversation, or not?
Okay.
Yep.
So let's do 2 things. Number 1, I am pro-choice. I believe in reproductive freedom. But there is a difference between saving moms' lives and supporting maternal health care and making sure that we have access to safe legal abortion care in this country. And I am very careful in my conversations to keep those things separate. Because we do not always share values around maintaining or providing access to safe legal abortion care in this country, but the vast majority of Americans share values around the need to keep moms alive, particularly in the year after delivering a baby. I mean, this is something that unites Americans. And so we try to really make sure that those are separate. Now, in the context of the upcoming presidential election, President Biden and Vice President Harris have been unequivocally champions of this issue. Vice President Harris was our Senate sponsor of the Momnibus in March of 2020 when she was in the Senate, and they have stood up the first ever White House Maternal Health Summit, and they put forward a blueprint and have really made some great progress on actions that they can take independently at the executive level. However, that does not excuse the need for congressional action, and so we're focused on doing our part, which is passing the postpartum Medicaid expansion and the full Momnibus and funding it at this $3 billion level so we can save moms' lives.
Thank you. Latona, what are some ways maternal health advocates can meaningfully uplift the work of community-led organizations, obviously beyond the fundraising piece? Like, what are the direct ways that people can engage and help?
In general, I would say including parents, birth workers, and the community advocates in your work, whatever that looks like, right? And so if you're a funder, you can use community members and parents to help advise what are the key things that we should be giving money to. If you are a policymaker, you can have a community-based advisory board. If you're in the media, you can have community members and parents tell you what stories do we need to be told, right? Nothing about us without us. And I have examples of why that's so important. So I sit on my state's pregnancy-associated mortality review board, which after a lot of the storytelling that Christy was telling us about in Louisiana, the state shifted its practice. Instead of just being obstetricians and physicians, as it had been, they invited community members, birth doulas, lactation consultants, to sit on that board and be experts. We went from saying that a quarter of maternal deaths were preventable, right? Which means 75% of those were, oops, sorry, nothing we can do about it, to when they made the board diverse, all of a sudden 88% of deaths in Louisiana were deemed preventable, because we can see the reality of people's lives in a different way, right? Another example, I served on my state's Safe Sleep policy committee, right? And before, the conversation about safe sleep was, don't share a bed, don't share a bed. As someone who has done home visiting for all of my professional life, we brought to the table, not everyone even has a bed. A lot of mothers are transient. They're just finding the safest place for them and their baby to sleep. And actually, this language is causing people to sleep with their babies on couches, right? Because they don't want to sleep in a bed. And that causes more infant deaths, right? And so those are just two little examples of why we need to have nothing about us without us. And I would say by shifting that practice, we can make a lot of change.
Christy, you do this work not just domestically, but globally. Can you talk a little bit about what you are seeing around the world from a solution standpoint? You know, some of the things that you've seen that have been really effective in other places, whether they are wealthy countries or impoverished countries that the United States could be thinking about or could be adopting?
Yeah, it's so interesting because I think during the pandemic, so many of our partners had to be really innovative, right, in terms of how to keep in constant communication with their families. And we see outside of the US, that's very normal, right? There's like innovation happening at the community level all the time because there are no resources. So there's so much to be learned, honestly, when you look across the world. There are best practices just based on like, this works. I mean, I've been in the most rural parts of Bangladesh and sub-Saharan Africa where there are death audits with the entire community involved after a mother dies, the entire community. And it's like, what do we do to make sure this doesn't happen again? Let's create a community savings and loans scheme. Let's bring more of the families in who are thinking about starting their families. That seems so simple. It's one of the most effective things I've ever seen. And then I also have seen like rural Peru in the highlands where the conversation around bringing traditional midwives and physicians and nurses to the conversation about how do we provide culturally concordant care, which means like, how do we be respectful with the communities that we're trying to keep safe? And so by doing simple things like not like by putting their names over their beds rather than numbers, by using floral sheets rather than white ones that might symbolize death, by allowing people to cook their own food and have their, go figure, their spouses or their partners in the room with them to help support them through labor. Like those kinds of things that are, they're not innovation, but they are innovation because they're a thing that we know that they work. But we need more of us to know that those simple solutions work, and we need to get behind them and get more people to utilize them.
And obviously you support the great work of folks like Latona. What are some of the other organizations that you work with in the United States that you think are doing really extraordinary work domestically?
Oh gosh, there's so many.
I know, sorry, you don't have to pick your favorite baby.
I mean, Jenny Joseph, who started Common Sense Childbirth many years ago, she's featured in my first film, No Woman, No Cry, and then was our first US grantee partner when we started to make grants. She's phenomenal. She's a midwife but also just an incredible activist, and I would say mentor to a lot of people in this space. And she started the first Black accredited midwifery school a few years ago. She's like really paving the way for that pipeline of providers of color that really, like, we need to see more providers who are there, and so there's more options for folks in the communities.
Mm-hmm. Thank you. Latona, I'm curious, on the ground in community, I have long worked in Texas, which is a state where there's been a lot of butting of heads between sort of traditional healthcare providers, whether, hospitals, physical therapists, who's licensed, who isn't, who gets reimbursed, who doesn't. How do you think about your role in this space, and how do you think about sort of forging partnerships with sort of, traditional healthcare providers that maybe have to become accustomed to doulas, to midwives in their midst?
Yeah, so I think an unfortunate trend that has happened in communications in the media is creating this idea that there is opposition or conflict between traditional providers such as obstetricians and more holistic community-based birth workers. As Christy said, this is a continuum. We need continuity of care, right? And so from the beginning, when I started Birthmark 12 years ago, we were in a context where many of the hospitals and obstetricians told their patients, you're not allowed to have a doula. And I'm really proud to say that thanks to relationship building and a lot of just shaking hands and meeting people and dispelling myths and speaking at medical schools and nursing schools, we almost exclusively get our clients from provider referrals. So physicians are coming to us and saying, I can tell this client really needs a doula. I know that you're going to make an impact. I want them to have a doula. We have partnerships with all of the area hospitals in New Orleans. And so that is the direction that things need to go. We're not interested in working as doulas, out in the Wild West without provider support, right? We want our families to be safe and have good outcomes. We need obstetricians. We need C-sections to save the lives of birthing people and babies, but we also need midwives. We need doulas. We need lactation consultants. We need mental health providers. We need the whole team to work together.
I was going to ask, speaking of mental health, Representative Underwood, how in the Momnibus Act, how are you all thinking about the sort of full circle? Obviously there's pregnancy, there's delivery, but that postpartum period, I'm someone who struggled a lot with postpartum depression, and I think thinking about how we provide those wraparound services, how are you all thinking about that from a legislative standpoint?
Yes, so we have within the Momnibus the Moms Matter Act, which is to address the mental health, behavioral health, and moms experiencing substance use conditions. In my state of Illinois, maternal mental health conditions are the leading cause of maternal death, the leading cause. And we know that culturally, there's a lot of folks who know what to look for, the signs of postpartum depression. We know how to support a best friend or a neighbor or someone from our church or a sorority sister who might be going through depression. But if there's an anxiety disorder, or there's a suicide ideation, or there's an addiction, there's not a lot of resources in most communities in this country to support mom, family, and baby. There's just not. And so as a result, moms are dying just because our healthcare system is not prepared to take care of them in every community. And so what we're doing is we're growing and diversifying that maternal mental health workforce, trying to address some of the stigma work, some of the bias, both implicit and explicit, right? So implicit bias, oh, I didn't know I was treating people differently. Explicit bias, racism, right? We have to do both to make sure that we're saving lives. The Moms Matter Act is one of the examples that is bipartisan in both the House and Senate.
Christy, how do you?
She's gonna.
I just want to add one piece, which I think addressing criminalization is super important to addressing maternal mental health issues, right? Because a lot of Black and poor mothers who might be experiencing psychosis, mood disorders, et cetera, are not getting help, addiction disorders, because they are afraid either of the apparatus of the child separation system, child welfare, or they're afraid of the criminalization and potential incarceration and separation from their existing children, right? So we need to also address that if we're actually going to be able to help Black mothers with maternal mental health.
And are you all able to work with incarcerated populations as well?
Birthmark has long served on state committees to bring doulas to women who are incarcerated and to improve the quality of prenatal and postpartum care for incarcerated folks. We have a very long way to go. That has been very, very slow work. We have accomplished being able to get a prenatal assessment upon intake for people who are incarcerated. We have not accomplished getting them doulas, and it's been a very painful, slow process to see that denied.
Christy, I was going to ask you about the mental health piece, because when we talk about maternal mortality globally, when we talk about it nationally, we really do sort of, I think people picture in their head, we're thinking about, the person giving birth, the bleeding out, the complications, that kind of thing. And obviously the postpartum piece, the mental health aspect of this really is deeply connected. How do you all think about that in the messaging? How do you think about that in the storytelling? And how critical is that piece to the work that you all are doing?
Well, I mean, there has been advancements in terms of the conversation around postpartum mental health, and thank goodness. And slowly, I think it's becoming less stigmatized. This film in Arkansas actually is really focused on mental health in particular, and that extension of coverage, because it really helps to pick up moms where they might otherwise have been left behind. As well, that paid leave piece is so critical. And so those three pieces that are highlighted in this film, and so clearly so, there's one mom who's very much struggling and stopped medication after she had her baby, but she talks about in the trailer that she's thinking about going back. Just the choices, or the lack thereof, I would say, that moms have. 2 weeks, I think, is the average amount of leave time across this country. I mean, anyone who's given birth or watched anyone give birth knows that, 2 weeks, you don't even know who you are. So, just it's so important to be paying attention. But there are also a lot of things that can be done earlier on, right? If there's a history of mental health issues or challenges, there are ways to be able to monitor that mother. And I think doulas play such an important role, and that's why the sitting at the table at home with the families, you know what's happening in the home. You know, what are the factors that might be impacting the mental health of the mother or birthing person, and that allows you to keep a different kind of eye throughout each phase of the pregnancy, so that by the time you get to the postpartum period, if you have resources and if they are available to you, you can connect those dots and hope that the mom can get the care that she needs. But I've heard too many stories as well. Moms completely isolated, living in rural parts of this country,
right.
Absolutely no access to service, no coverage whatsoever, and they die. They die.
You've told stories through film in a lot of parts of the country. Why did you choose Arkansas for this latest chapter?
Arkansas happens to have the current ranking of the worst place in America to give birth or become a parent, mother. So that's one of the reasons we were invited down to explore. We'd actually been researching down here in Texas in 2019 before pandemic.
That would be a pretty good choice
and
too,
we were
unfortunately.
like, this is a big state. How do we tackle all the things happening here for all the obvious reasons? But then we were invited to sort of take an eye, and the fact that their ranking was so poor, it made good sense. And it really has allowed us to sort of look at a state that has so many of the challenges that we're looking at a national level to really highlight. It's a rural state. The point about technology, I think, is really interesting, because there are these technology solutions, and yet mothers living in the Delta, they can't call an Uber to get an emergency transfer anywhere. They can't, that's real in this country, that people don't have access to technology and, the band. That just doesn't happen. So it made sense, still makes sense. But Louisiana, I mean, there were challenges then when we were working there, or putting our lens on that state. And yet today, I'd say Louisianan moms in this post-Dobbs, there's a very specific challenge happening right now, which actually links your state and your state, in terms of the amount of moms who are having to travel to another state to get abortion care.
Yep. Or a state like Texas, for example, beyond even abortion care, where rural hospitals are going out of business right and left, and people don't even have access to basic transportation to get there.
Hospital closures, that's another huge problem across this country.
How, to any of you, how do we solve this challenge without solving, this is so obvious and big, but poverty. You know, I mean, so much of this from beginning to end is about access to care. It's about being able to afford care in this country, particularly in states that have not expanded Medicaid. It's, you know, diapers are expensive. We've written at the 19 stories about, you know, mile-long lines for women to pick up diapers in the Ozarks. I mean, how do we, all of this is linked. It's linked to paid leave and the lack of leave that mothers and parents experience. How do we solve this really complex issue without tackling all of those issues first?
Well, I think we have to do all of it. I certainly support a national comprehensive paid leave program that includes the Job Protection Act and the Family Act. We need to do both to make sure that the opportunity of paid leave gets to every worker. Secondly, we have to have paid sick days, right? That's essential. Pregnancy is not an illness. And so you got to make sure that if there is a disease state, people have leave. But we have to, representation matters, okay? These issues have not had national attention until we had a more diverse Congress. Until, you know, there's no coincidence that this is the first presidential administration that has centered these issues. Why? Because we have our first female vice president, and she has been a champion throughout her career. There's a real synergy there, which means that this is the moment to get all of the above done. But I do really want to be clear about the nature of this crisis in the United States of America, which is not just a crisis of poverty, right? Like, we are seeing Black moms die across the income spectrum. You know, you could be Serena Williams, you can be Beyonce Knowles, you can be Allison Felix, the great track Olympian.
Who's down the street.
Yeah, who's down the street apparently, or in the building. You could be a regular woman on the block or around the neighborhood and just trying to survive. And yet we are all at risk of much greater rates of severe morbidity and mortality in this country. And so we have a long way to go. The path to progress is not linear, and it's often not short. But we are making progress. We can't be discouraged. We can't give up. And I think that there's joy on the other side of this, right? And so, you know, we want to make sure that not only are we surviving, but that, you know, giving birth in this country can be a joyful experience for all families.
And so, speaking of joy, Latona, tell us what this looks like when it works. Talk to us about a parent. Talk to us about a mom who you've, without violating HIPAA, who you've followed, you know, from start to finish. Tell us what a success story looks like here.
Yeah, I've been to so many joyful, beautiful births, and I think some that really come to mind are the folks who we walked with through pregnancy, birth, and postpartum, and then they actually became birth workers because they were empowered by that experience and they wanted to offer that to their community. So one of my trainees currently was a doula client of ours who her first, and many people come to us for doula support on baby number 2. Because they don't know what they don't know the first time around. They have an experience that is traumatic or negative or harmful, but they survive. And the second time around, they want something different, right? They know, they talk to other moms and they realize that wasn't right, that wasn't what was supposed to happen. So she was one of those folks. For her second baby, she wanted a more positive experience where she was in charge of what happened to her body. She got a doula. She wanted an unmedicated birth. It is a myth that doulas only support unmedicated births. We support all birth plans, all preferences. And she ended up having the birth experience that she wanted. Her and her son were healthy. She's a Black native New Orleanian. And she actually loved breastfeeding so much that she started a breastfeeding support group in her neighborhood. She decided to become a lactation consultant and then a doula. And she just got certified as an international board certified lactation consultant, of which I was the 3rd Black IBCLC in the state of Louisiana. When I became an IBCLC, we completely lack Black lactation professionals in this country. So that is a really, when I think about that, that keeps me going.
Amazing, thank you. All right, quick question about the films. If you want to see more of these, if you want to watch the full Arkansas film or see the others, where can folks find them, Christy?
Next month, the Giving Birth in America Arkansas, the 7th installment, will be able to be seen on our website, everymothercounts.org, and all of the other films live there. We have Giving Birth in America New York, Florida, Montana, California, New Mexico, Louisiana, and now Arkansas. So we will keep telling these stories as long as we have to. And there are limitless stories to be highlighted, limitless providers to be elevated. And yeah, I hope you'll check it out.
Amazing. And beyond watching the videos, watching the films, what are immediate steps folks in the audience can take if they want to help alleviate the maternal health crisis, either domestically or internationally?
There are some cards around the room, and also I think it was just up on the screen, there's a QR code that you can connect to, and it's sort of an easy way for you to be able to take action, follow these bills that we've sort of talked through and described, and become a part of this. I mean, it makes it so easy to be able to reach out to your representative, know who to contact and what to say, and to learn more about the details of the bills.
Great, thank you. And Latona, what about you? If there folks here in this audience want to help, if folks get to tune in and hear this audio in Louisiana, what do you want them to do?
2 things. 1, donate. Donate to Every Mother Counts, to Birthmark, to the community-based birth worker organizations where you live. And number 2, everyone knows a pregnant or postpartum or parenting person in your life. It is a hard time to be that in this country. Offer support, offer resources, carry her groceries. Instead of buying a ton of fancy baby clothes, do a fundraiser to get her a doula or a lactation consult or a postpartum doula. Offer the pregnant people in your life support.
Amazing. And Representative Underwood, tell us what you want folks to do, what you want them to do ahead of 2024, what you want them to do now with their elected officials. How do people get engaged?
You can follow us online at BMH Caucus on Twitter, and we'll keep you updated on our legislative progress. Please reach out to your representative, your congressperson, and your 2 senators, even if they do not share values with you, okay? Even if they do and you feel like, oh, that person's good, give them a call anyways. They need to hear from you on this issue, or else they'll think that people don't care. They'll hear from me, but they really want to hear from you, okay? And the last thing is this, and it's so obvious, but it's really important, please vote, okay? Every election, even if they're not your favorite, right? We have the ability to see the change in this country, but we have to demand it.
Well, if you all in the room want to get engaged on this, remember, first of all, you'll see some QR codes on the screen, but there are also cards around the room where you can do your own part to take action. And on behalf of this extraordinary group of women, thank you all so much for coming, and thank you to you all for your work and your participation.